the actions that we took were to bring down our COVID cases, to educate the public about this unique threat that COVID presented, especially to communities of color and the African-American community in particular. But there's no question the biggest obstacle has been the White House itself.
Now, you have faced quite a bit of obstinance in our home state. When, of course, unfortunately, Michigan made news because of what the Board of Canvassers did, or attempted to do, I should say, by trying not to certify specifically the votes in Wayne County, pinpoint Detroit, which is obviously the largest city in Wayne County. How surprised were you that they originally deadlocked to not certify these votes?
Well, I was surprised because these are not positions where there is judgment. They are ministerial. It means, they just take in the numbers and then they certify it and send it on. It is not their job to go through and assess. That's already been done. So they take an oath to do this, and any games to undermine that it could put them in ethical and certainly legal jeopardy as well. So the fact that these people could be talked into putting themselves in personal jeopardy by a White House, it's really stunning. Like, this is not normal. I feel like we have to keep saying that in 2020, but this is not normal, and it is not acceptable. It was explained, I think a couple of legal minds explained it this way. These ministerial jobs are simply to do the paperwork. It's like when you go get your driver's license. You have an instructor that decides if you pass or fail. But then you have your certificate that you passed. You go in and hand it to the person at the Secretary of State's office, and they give you your license. They are the ministers of what's already been done. That's what a Board of Canvassers does. They just sign off and send the paperwork, do the math, send it in. It is not theirs to go back and say, I don't know, did you actually pass this test? No, that's not their job. They need to, do their job, respect the will of the people. And I think the attack on Wayne County and having the largest population of African Americans in Wayne County, it's not lost on me what's going on there too. And I think it's important that we recognize that.
Yeah. What is your message, though, to Black residents in Detroit who've had to stomach seeing officials in Michigan, officials that are supposed to work kind of on their behalf, work actively to disenfranchise them? Because they also have to then see, people from the Michigan legislature go meet with Donald Trump. What can you say to them to reassure them that there is not this plot to really minimize, diminish, or eliminate their voices?
Well, we know that Joe Biden won. We know that Wayne County was the most important part of the puzzle. The road to the White House goes through the state of Michigan. And if you go through the state of Michigan, you go through Wayne County. The voters will be respected, and that's my job, as well as the Secretary of State and the Attorney General, and we're doing our jobs to ensure that. But going forward, we can't ever permit this kind of gamesmanship it's just really stunning. And I think it's important that people in positions of power call it out and call it what it is. And it's whether there's domestic violence being perpetrated against a sitting governor or Dr. Fauci, or it is domestic violence seeking to disenfranchise a majority African-American city. We're going to call it out, and we're going to seek justice, and we will not let it stand.
I want to make sure that I phrase this correctly, because I know that people get sometimes locked in on phrases. Michigan right now, you have imposed some new restrictions on coronavirus. I think you called it a pause. Is that correct?
Yes.
Okay. All right. I want to make sure I got that right so that people don't lose their mind about what it is. That, of course, was, again, met with some backlash, which you have encountered as you have even earlier in this virus, as you impose many of these restrictions. What has been the biggest obstacle for you in trying to get people in the state to understand why this is necessary to do as we go through every day setting new records for coronavirus cases?
Well, honestly, I think the biggest obstacle has been the White House. And we have a White House that has never shared consistent or accurate information about the virus. The president knew how serious this virus was. And yet, from his biggest megaphone in the land, He has continually undermined efforts of the nation's governors to do what didn't happen at the federal level, and that is to step up and to create the systems to protect people and take the actions to keep this virus at bay. Back in March, when Detroit was just exploding with COVID cases at the same time New York City was, and New Orleans and Chicago, we were calling on assistance from the federal government. I simply needed N95 masks for our nurses and doctors in Detroit hospitals that were full already. And basically the message from the White House is, we're not your shipping clerk. Go get them yourself. And that's when the governors started trying to out-compete one another just to get our hands on these masks and gloves. African Americans are 14% of our population in Michigan. There were 40% of the cases, 40% of the deaths in those early days. And so the actions that we took were to bring down our COVID cases, to educate the public about this unique threat that COVID presented, especially to communities of color and the African American community in particular. But there's no question the biggest obstacle has been the White House itself.
Do you think if you were Ron DeSantis that you would have got that reaction?
Of course not.
Just wondering. I mean, I know he, in particular, the administration was like, if you're in a Democrat-run city, you just ass out. Like, that's just the end of it. I'm like, wow, I did not realize this. Okay.
Yeah, no, of course not. But then again, if I was Ron DeSantis, I wouldn't have done anything, and we'd have lost thousands of more people.
Yeah, I was going to say, you also probably wouldn't have asked for the mask either. So there's that part of it. So, of course, as there has been a lot of misinformation, a lot of back and forth by people about the effects of this virus, then we recently have Matt Stafford's wife going off on social media about how you have put her in a dictatorship. When things like that happen, first, what's your response to what she said, and how does that sort of impact your relationship with the public as somebody who's trying to govern through a very unique and difficult crisis?
Well, I get it. People are frustrated. They're tired of it. They're exhausted. They're stressed. We've lost over 8,000 Michiganders to this virus. There are, countless kids who would they'd be so much better off if they were in school, but they can't be because of the toll that this virus has taken. We've got businesses that have been closed or are closing again right now. It's a hard time. It's hard, and people are frustrated, and I get that. However, we are not out of the woods yet. This virus is raging across our country. The numbers that are happening right now in America are worse than anything we saw in the spring. And so it's really important that we stay tethered to the epidemiology, listen to the public health experts, and try to get our federal government to give support for these businesses that are struggling. I don't want restaurants to go under. I don't want people to be out of work, but I know that the nature of this virus is the more people inside from different households in places where they're not wearing masks, it's inherently dangerous, and it's contributing to community spread and more loss of life. And so we've got to get our arms around the crisis in order to get our arms around the economic toll that it's taking. So I can't be bullied. I can't listen to every post and question the decisions we're making. We've got to follow the epidemiology. I spent yesterday, so we're talking on a Monday. I spent Sunday talking with national experts on COVID, Ashish Jha, Scott Gottlieb, the people that you see on the national news all the time. So we could ask questions, and we're in for a couple of hard months. There's no question in the Midwest, especially when the temperatures go down, we go inside. We are in the holidays, which is inherently more dangerous because people are unfortunately traveling and gathering, which we've asked them not to, but they're still going to do some of that. And we're going to have a couple of tough months ahead. However, the vaccines are on the horizon. This spring, there's light at the end of the tunnel. And so there's reason for concern right now in the moment, in the next 8 weeks, 10 weeks. But beyond that, there's reason for lots of optimism. And that's what we have to try to balance here.
the word that everybody is afraid of is lockdown. What's your level of confidence, though, that though we are not able to transition properly into the next administration, we have a stimulus bill that continues to sit that has not been voted on. Thank you, Mitch McConnell. I'll say it. I mean, I don't think you probably, I have no idea how you feel about him. I think he's an awful person, but let me just skip ahead. The whole point is that we have this assistance that's right within reach, but not quite there. What's your level of confidence that maybe this time next year, it will be a different reality for us in this pandemic? A good reality.
Like 1 year from right now, this
Yeah,
time next year, it'll be much better.
You think so?
Life's going to
Okay.
be a lot better. It absolutely is. We're making huge progress in vaccines. Now, vaccines aren't, as soon as there's a vaccine approved, it doesn't mean automatically everyone's, you can resume life as it was. However, we will be able to ramp up and get people vaccinated. But we got to earn the trust of the public. Certainly, people are going to be skeptical with all the politics around vaccines in this year. It's going to be even more important that we educate the public about the efficacy and the safety of these vaccines, that we make it easy for people to access. We can't assume everyone in a rural community can get to one location, and we also can't assume that everyone in an urban community is going to have confidence. Like, this is going to take a special kind of outreach to different communities, and it's going to be an undertaking unlike anything this nation's ever gone through. So we got our work cut out for us, but I definitely think that there's reason to feel very optimistic about where we'll be a year from now.